Yeah, so did you hear this about Medicare and Medicaid? Well, if not, I'm going to share with you the details here in this video, as yet again, we have some other massive changes, a huge shakeup, and some major transitions coming into play, which is affecting Medicare and Medicaid. And again, I'm going to share with you the details here in the video. If you have not heard this yet, you certainly want to hear this information. Let's get right into it. Now, first off, I'm talking about Medicare and Medicaid. These two programs, which are pretty similar, but also very different at the same time, encompass about 140 million people in this country, which encompasses about 42% of our total population. I just wanted to put that into context really quickly to show you how massive this is and how many people this may be affecting going forward. So, yeah, interesting, right? Which, by the way, do you think 2025 has been a little bit eventful and kind of interesting so far? I'm not sure about you, but I find this to be pretty interesting. We're not even that far into the year so far, and we've had so many massive developments. You've heard me talking about all kinds of random things we never could have imagined would have happened. And we're just getting started. This is still on the cusp of a lot of other changes that are to come here. And again, as always, I will keep you posted. All right, so anyway, you've heard me talk about the new department that literally just started like not that long ago. I mean, literally, we're within days of this department starting. What is it called? DOGE, Department of Government Efficiency. You've heard me talk about that before in other videos, and I've alluded to some of the different changes and some of the things that they are disrupting, should I say? I don't know what the word would be. Disrupting sounds like a pretty good word right now as far as all of these different federal agencies and all these things like this, right? So remember, what is the purpose of DOGE? To basically reduce federal spending by about $1 trillion. That's their target. $1 trillion by the 4th of July next year, 2026, okay? So it's going to be here for about a year and a half-ish, the department, and that's going to be it. So they're really going to work on this thing. Anyway, I want to talk about what just happened here, which, by the way, if you are one of the people leaving comments down below asking questions about Medicare, Medicare Supplement Plans, Medicare Advantage Plans, Medicare Part D Plans, your initial enrollment into Medicare, a lot of really good questions coming in lately. Thank you. I truly appreciate it. Your best resource not only is me right here on this channel. Again, I'm happy to answer questions for you in any way that I can, but that phone number right there on your screen with my partner over at Chapter Medicare, the leading brokerage in the United States, they will go to work immediately on your behalf for free, finding you the best plan in your local area that fits all of your needs, the providers you want, the prescription plans you need or don't need, your other personal preferences, and they'll save you a boatload of money along the way. They will help you find the right plan, not just a plan, and it's all 100% free with a free consultation. So for those of you that have been wondering, that's the best thing you can do. Call that phone number. You will connect with a person there, very professional. My friends over there at Chapter Medicare, please tell them I say hi. Amazing people there doing amazing work for those of you here in this community. Awesome stuff. You got to look at your plans here. So many people, 90% of seniors have the wrong plan. Anyway, connect with them. They'll do it right for you. Awesome stuff. I'm so glad to have them on our team here, and thank you so much for being part of this community. All right, so anyway, let's talk about Medicare and Medicaid, because what is DOGE doing? Department of Government Efficiency. In fact, I got an article for you. Let's pop it up on the screen right now. You can watch and read along here and look what DOGE is doing. What are they doing? Well, they're kind of gutting Medicare and Medicaid. That's a very what's the word I'm looking for? That's a really vivid word to use, but I'm going to use it for now, okay? Don't get too worried about it. But basically what they're saying is that Medicare and Medicaid is the motherlode of fraud. Okay, let's see what happens here. Because remember, what is the purpose of DOGE? To reduce federal spending by about $1 trillion in the next year and 4-ish months or so, right? That's their objective. So they're trying to save $1 trillion. Well, guess what? If they call programs like Medicare and Medicaid the motherlode of fraud, what does that mean? They're going to be looking at every little aspect of this program and doing whatever they possibly can to clean it up, okay? Now, would this be a good or bad thing? I mean, I don't want to sit here and be like, oh, it's so good. I mean, I don't know what they're going to do. That's the problem. As you can see here in this article, as you've probably been reading along here a little bit, we don't know exactly what they're going to do. They're going to go in, tinker around with some things. who knows what? I don't know. We won't really know until it's already done. But the interesting part is that they have access to this, apparently. They have access to CMS, Centers for Medicare and Medicaid Services, which oversees Medicare and Medicaid, again, for the roughly 140 million people, 42% of our population in this country. It's a huge, huge thing. Now, one thing I want to see really quickly. No, they're not going to take away your Medicare. No, they're not going to boot you off of Medicaid. No, they're not going to, single you out and do something like that. I'm not saying that whatsoever, okay? Please do not worry about that. But rather what they're going to do is they're going to clean up the program and make sure that it's working efficiently for the beneficiaries and for the program as a whole, okay? In fact, you probably heard me talk about this. I'm going to say maybe, I think it was late last year in 2024. I think it was then. I don't remember exactly when it was. But I was out in a couple different videos around that time, and I was talking about these different pharmacies around the country. I don't want to say names here in this one. You know who they are. I've talked about them before. But some huge name pharmacies. We all know the name. If I said the names, you would, oh yeah, I got one right down, 0.3 of a mile from my house. Yeah, exactly. They're everywhere. Anyway, some of these huge name pharmacies are out there, basically double billing prescriptions and like filling prescriptions that were never dispensed. I mean, like billions of dollars worth of prescriptions that they said were going out that really were not going out, and they were being paid for by Medicare and Medicaid for these patients that were never picking them up. My point is, they got fined massively. I mean, I talked about it at the end of the year. I think it was maybe in December, possibly, maybe November. I don't remember exactly when it was. It was around the end of last year. The point is, this is exactly what they're targeting, is things like this, major discrepancies that are happening where these different, again, I don't want to single anybody out in particular, but I'm saying maybe it's healthcare providers, maybe it's pharmacies, whatever. The list goes on and on. It's massive for all these different things that are billing Medicare and Medicaid, but maybe not providing services. And that's called fraud. So they're trying to go crack down on that and basically say, oh, no, you don't. You're not doing this, right? So they're not going after the beneficiary. I want to make that very, very clear. They are not going after the beneficiary. Please do not worry about it. I know there's a lot of talk out there in the headlines. Oh, they're coming after Medicare. They're going to dismantle the program. They're going to kick everybody off. No, they're not. That's ridiculous. They're not going to do that. Okay, will they change Medicaid? Will they change Medicare? Possibly. But right now, that's not the objective of what they're doing, okay? I just want to make that very clear. Again, I'm watching all this very closely. I see the headlines. I see what you're seeing as well. I dig into it. When I see something that seems a little weird, I dig into it and I find all the resources I can about it, and I try to uncover the truth on it. Sometimes, honestly, there's just so much weird information out there, it's kind of hard to dig down to the bottom and figure out like what is really going on. There's a lot of misleading information. Anyway, that's been my dedication for you here on the channel for years now. As I've said, I will do the research on your behalf. You don't need to. There's so much information out there. I will find the facts, I will find the reality, and I will deliver it to you here in these videos with honest, accurate, reliable, and transparent information. I'm not going to blow smoke. I'm not going to beat around the bush. I'm going to literally give it to you straight. That's what I like. Me personally, I like the truth. I like it straight. Just seriously, just tell me what's going on, okay? I say that to my wife all the time. I think it drives her nuts, honestly. I'm just like, she'll tell me something and I'll be like, no, tell me how you really feel. Just seriously, just give it to me already. And she's like, okay, fine. Here's what I really think. Your shirt is ugly. You shouldn't wear that. Throw it in the garbage. Okay, fine. I'll do that. Thank you. Thanks for telling me already, okay? I hate your haircut. It's ugly. Get a new haircut, right? She doesn't say that, but I'm just using that as an example. Things like that. So I just want to give it to you straight. That's exactly what I want. And that's what I do here on the channel as well. Anyway, this is interesting. Let's see here what DOGE does to Medicare and Medicaid, and I will continue to keep you posted on that. But again, if you have those questions, for those of you that have been reaching out, I know I've been talking about Medicare and Medicare Supplements and Medicare Advantage and Medicare Part D and all these plans lately. It's huge. The reason for this is this. I saw my parents go through this. I helped my parents enroll in Medicare and get a supplement plan recently. It was an absolute nightmare. It was frustrating. We were running in circles. We were being misled. All kinds of information. I don't want that to happen to any of you here in the community. After going through that with my parents, I'm sitting here thinking, this is nuts. Why is this so complicated? Why? I mean, I understand this stuff pretty well. Why is this so complicated? It shouldn't be, right? That's why I partner with Chapter Medicare and why we have this phone number here on the screen. They will go to work for you, 100% free. They will look through your situation. They'll present you the plans in your area, and they will find the best ones for you and present that. And if you're the average senior out there, they'll save you a lot of money. The average senior being saved $1,100 with their work. That sounds like a real savings to me, right? Anyway, let me ask you a huge favor of you. Just one favor, that's it. Who do you know that would benefit from this video? Who? I know you can think of one or two people, your friends, family, neighbors, acquaintances, siblings, things like that. Please feel free to share this video with them. There's a share button right down below. It is 100% free to do so. Thank you. I truly appreciate all of you here in this community. Also, make sure to subscribe as well. It's 100% free to do so if you want. Thank you so much. I really, really appreciate that. Thank you for being part of the community. Otherwise, check out the other thousands and thousands of videos here on the channel in the video library. Check those out and feel free to share those as well. Otherwise, thank you so much for allowing me to advocate for you, to represent for you. Again, thank you so much for your continued support and trust in me and these videos and the content and everything that I'm bringing you every single day. It truly means the world to me. Thank you so much for being part of this community. Also, have a nice day. That's all that matters right now. Please remember, I'm here for you in any way that I possibly can be. Let me know what I can do for you. There's no limits on what I can do for you, okay? Just please let me know. Otherwise, have a good day, and I hope I can see you again soon in the next video.